Hello everyone, I'm Dr. Medha, your pathologist, here to simplify some complex medical concepts. And if you are into medicine or learning or just curious, you are at the right place. So let's begin. Have you ever wondered how these bones are formed in our body? So today I'm going to teach you how bones are formed. So let us begin with the bone formation. So what is bone? Bones are basically specialized connective tissue, and these specialized connective tissue make framework for our body, which is the skeleton. So what are the function of the bone? It forms a framework, provides support, helps in movement, mineral homeostasis, and site for hematopoiesis. So this is the basic thing that we all already knew. So when this development of bone starts, it starts from the very intrauterine life. We all know that there is a time of gastrulation which is around 3 weeks, in which different germ layers are formed. So from one of those germ layers, these bones are formed. So the development of bone starts from the intrauterine life and continues throughout life. It is not like that once the bone is formed and now it stopped forming. So here this photo is describing the same thing, that when you are in intrauterine life, when you are a child, adult, or even an elderly, the bone formation continues in the form of remodeling. So now here's a term which is osteogenesis. It is quite understood that osteo means bone and genesis means formation. So the process of bone formation is known as osteogenesis. You're very smart at it. So as I told you that at the 3 weeks of intrauterine life, different germ layers are being formed. What are those germ layers? The ectoderm and, very important, the mesoderm, and this is your endoderm. So the development of bone is occurring from the mesoderm. From the mesoderm, mesenchymal progenitor cells are formed, and these mesenchymal progenitor cells then differentiate either into chondroblast or the osteoblast. So from the mesoderm, mesenchymal progenitor cells, and then these mesenchymal progenitor cells are differentiating into either your chondroblast or your osteoblast. Chondroblast will form cartilage and osteoblast will of course form the bone. So how these bones are being formed? So there are two processes of bone formation which I have already mentioned here. The one is the endochondral ossification and the second one is the intramembranous ossification. As the name is suggesting, from the endochondral ossification, we can assume that something chondral means cartilaginous is being formed first and then it is being replaced into the bone, and whereas in intramembranous the bone is directly being formed from the osteoblast. So we can write it and then move further. In endochondral, first the cartilaginous framework is being formed and which is getting replaced by bone. Whereas in intramembranous, from the osteoblast directly bone is being formed. So it is important to know which bones are endochondral and which bones are intramembranous. So always remember that most of the bones are endochondral in ossification, or in endochondraly they are developing, whereas few bones like your skull, mandible and clavicle. They are intramembranous, means they are directly being formed from the osteoblast. So now the bone is formed. This is the mature bone which is already formed till now. So what is the composition of these bone? So we can divide them as cellular components or extracellular components. The cellular components are important, but it doesn't mean that the extracellular component is not important. It is equally more important. So in the cellular components you have the cell osteoblast, you have osteocytes, and then you have osteoclast. So what are the function of these cells? I have a cute little image for you to show these function. Now what is the extracellular? The extracellular component is basically the matrix, which can be organic or inorganic. So basically the organic one is the osteoid. Let me write it for you. It is the osteoid. Now it is important for us to know the composition of the osteoid. Just remember three things. The one is the type 1 collagen, then your proteins, and then your glycoproteins. Type 1 collagen is important to remember. Question is asked, which collagen is present in the bone? It is type 1 collagen. You can remember it in the way like 1 ONE, and this becomes bone. So bone has type 1 collagen. Now what are the glycoproteins? These are important. You have to remember their name. It is osteopontin and osteocalcin. Now what is the inorganic component? It is basically calcium hydroxyapatite crystals. So till here we have known how the bone is formed and what is the composition of the matured form bone. As I promised, I will show you a cute little image to show you the function of the cells. So here is the image. You can see the happy looking cells and some angry red cells. So the yellow happy cells are basically the osteoblasts, which are happily laying down the new bone. And then beneath them you can see the one-eyed cell. It is basically the osteocyte. These osteocytes are derived from the osteoblast. When the osteoblasts get trapped into the matrix, bone matrix, then they convert themselves into osteocyte, and they will now maintain the homeostasis and mechanical stress. They sense the mechanical stress. Now these angry looking cells are basically the osteoclasts, whose function is to resorb the bone. So these three cells maintain the bone homeostasis and their bone resorption. I hope you understood. So one of the confusing thing is the classification of bone. How we are going to classify the bone? So there are various parameters on the basis of which we are classifying the bone. The first one is on the basis of their structure, like how their structure is, how they are being formed. So in the structure it is the compact bone and the spongy bone, and on the basis of shape we commonly know that we have long bones, we have short bones, flat bones, irregular bone, sesamoid bone and pneumatic bones. And on the basis of development, which I have already discussed, is the membranous and the cartilaginous. And on the basis of location, it is the axial bone, skeleton or the appendicular skeleton. So now let me tell you something about the compact bone and the spongy bone. So here I have incorporated an image of the cortical bone and the cancellous bone. Cortical bone or the compact bone, as the name suggests, it is compact, means it is dense. So how it is being dense? It is made up of concentric lamellae. The concentric lamellae have osteocytes in between them, which are present inside a lacunae. And then in between these concentric lamellae are present the Haversian canal. Whereas when it comes to the cancellous bone is made up of a meshwork of bony rods or trabeculae. As you can see the trabeculae here. Each of the trabecules is made up of a number of lamellae, between which lacunae containing osteocytes are present. And basically they cover the bone marrow and they have protective function also. So I hope you understood how the bone is being formed and what are the different classification of bone. So if you like the video, please do like, subscribe and share it with your colleagues. Thank you so much.